All right, time now to turn our attention to some health news this morning, and we're going to be talking about our joints. Maybe you are suffering from joint pain. Is now a good time to actually do something about that? Well, this morning I'm so happy to welcome in Dr. Alexander, a board-certified orthopedic surgeon with AdventHealth this morning. Good morning, doctor. Thank you so much for joining us.
Good morning. Thank you for having me.
I feel a lot of people talk about this, and the older I get, I hate to say it, but I'm beginning to notice it a little bit as well. When your joints just don't move as easily as they used to, you kind of start to feel things that you didn't before. How common, let's start here with kind of joint issues and having to do something about it.
Yeah, I mean, it's common. Arthritis, primarily hip and knee arthritis we're talking about. Arthritis affects everybody. I mean, as we age, it's inevitable. And so our goal as physicians is to keep you moving and keep you involved in your hobbies, your activities, whether it's vacations or, athletic events, keep you moving pain-free.
Well, and it's interesting because I think more than ever, we're realizing how important it is to keep moving in 2020 and the pandemic that we're going through, how important that is for our well-being. Is right now a safe time to come and see you and do something about joint pain if something like surgery is needed to be done?
Absolutely. The hospitals, the office staff, incredible measures have been taken to make things as safe as possible. And there have been, countless meetings, especially at the beginning of this pandemic when we really didn't know what to expect. Every single patient and person that enters the building of that hospital is tested for COVID. Every person that works in the hospital, whether it's somebody that works in maintenance staff or physicians, nurses, every single day at every entrance, we get screened, temperature checks, and so the hospital offices, everybody is taking all the precautions necessary. Everybody wears a mask. And of course, all the social distancing, limiting visitors when necessary. So it's as safe as could be.
Let's talk about when it actually comes down to surgery. Who is the best candidate? How do you know when someone is ready to actually take the surgery approach?
Well, first of all, you have to have the diagnosis. And so for hip and knee arthritis, you want to make sure that that is the diagnosis. Do you have hip and knee arthritis? But then we say, we treat the person, not the x-rays. And so even though you may have hip or knee arthritis, then it comes down to how is it affecting your life? Is it limiting your activity? Can you not go on trips? Can you not play with your grandchildren? Are you not able to golf? If those answers are no, and you're just not having the quality of life you want, then it's something to consider. But we also don't want to rush right into surgery. Even though we're surgeons, there's other things we can do. There's medicines, there's injections, there are braces, there's physical therapy. And so there are multiple things that we can do to help the patient.
Let's say, though, that surgery is the best option. What does recovery look like, doctor?
So hip replacement recovery, a little bit easier than knee replacement, but still on the average, you're looking at a one-night stay in the hospital for most cases. Some folks, if they're young and healthy, we're actually sending those folks home same day. And so people will use a walker because it is a surgery. We do want to be safe. There is therapy involved. People use their walker for about a week or so, sometimes less, sometimes a little bit more. Physical therapy comes to the house for a few weeks, which is especially great with the COVID pandemic. You don't have to go into public or to go into other offices. So the therapist comes to you. After about that week or so, when you're off of the walker, you're on a cane for a couple of weeks. And by the third or fourth week, you're walking around with no aids. And hopefully by the sixth week, getting back to all your activities, whether it's traveling or golfing or bowling.
All right. Well, we're out of time here. As we close, what's your take home? What do you want people to understand when it comes to joint surgery and treating this?
Just let folks know that, we're here to help you. Our number one goal is pain relief. And so, whether it's surgery or non-surgical treatment options, we want you to enjoy your life and to do the things that you love doing.
And again, 2020, I feel like people are realizing that more of what's important and being able, as you said, to be with your grandkids, to live life in the fullest. Doctor, thank you so much for your time. We appreciate it. We put up the website there so people can get in touch with you and your team.
Thank you. Be safe.
Thank you.
All right. Have a good day.